Good afternoon, everyone. Welcome to our sixth Community Leaders Update on the COVID-19 virus pandemic. I'm Mike Wilder. I'm Director of Emergency Management for Danville and Boyle County. Today we have present with us Mayor Mike Perros, Boyle County Health Director Brent Blevins, Judge Executive Howard Hunt is a little bit under the weather today and chose not to participate today, but we have in his absence the one renowned Miss Kathy Miles, who is the Director of the Agency for Substance Abuse Policy in Boyle County. Kathy, glad to have you.
Thank you. It's good to be here.
A couple of things I want to mention quickly is as we're all beginning now to turn our attention to the possibility of reopening the state of Kentucky along with Boyle County, we need to be reminded again as the governor said in his remarks yesterday, that benchmark criteria, those 7 different items that he has brought to our attention that have to be completed pretty much before we can start this process big time. The 7 are, real quickly, 14 days of decreasing cases, increased testing capacity and contact tracing, personal protective equipment availability, ability to protect at-risk populations, ability to social distance and follow Centers for Disease Control and Prevention guidelines on large gatherings, preparedness for the possible future spikes, and the status of vaccines and treatment. And of those 7, there are 3 that stick out to me pretty quick that we're quite a ways from being able to accomplish. One of those being 14 days of decreasing cases. Because as we looked yesterday, we had the single most number of cases in one day that we've had so far. We had 273 cases, positive cases. So we're some little bit from going that 2 weeks, those 14 days, without having a real decrease in cases. Of course, this was all anticipated. Brent has talked about it many times. The governor, the president, anybody in the know has mentioned the fact that we anticipated this for the simple reason that we are increasing the testing, and it's going to continue to increase. This week, supposedly, we're going to have 4 new sites open. We don't know what's going to happen after that, but at least these 4 will be open supposedly this week to test. So, you know, they're anticipating the possibility of anywhere from 200 to 250 to even 300 people a day being tested out of these sites. So you can imagine the numbers, how they're going to swell probably pretty good as we go on. Again, I mentioned the fact that, and we had some issues with this over the weekend as far as Boyle County possibly being a testing site. That was in the conversation. We've had more than one conversations, and at the Boyle County Board of Education meeting the other night, it was misconstrued by the newspaper that Boyle County had actually been selected as a site for testing. That is not correct. What we were doing in that capacity was in order for Boyle County to even be considered for a testing site, the proper documentation had to be submitted to the Board of Education and their approval given, which that was what was done on Thursday night. The paper did see that error, and we got them to make a retraction on Saturday morning early, and they pulled the story off certainly that quick. Again, I have not had any updates. I don't think Brent has either as far as any kind of possibility that we will be a testing site. Again, I know what they're trying to do. They're trying to go to the counties and areas that have been hit hardest. Thanks to the many things that we have done throughout the county and city, we're not one of those places, very honestly. So who knows? We'll just have to wait and see. One of the things that we see on those 7 criteria is the possibility of protecting people that are at most risk. We talk about our long-term healthcare places, which is great. But one of the places that a lot of people don't think about or even consider is the facility that we have out on the Bergen Road, North Point Training Center. North Point is almost like a city in itself out there. I got to taking a look and thinking, well, I'll reach out to the warden out there, Brad Adams, who is for everybody's benefit, is a native of Boyle County originally. His dad was here for many years, and I've known Brad for a long time, knew his dad. But I reached out to Brad and got some information from him, and it's pretty compelling. We have out there at any given day at least 1,200 to 50 to 1,270 inmates on the grounds, plus another 350 staff members, which include contract workers. And as of today, North Point Training Center has had no positive cases from inmates or staff. And I think that's something that they need to be called out with and made mention of, because that many folks, and not under the most ideal circumstances anyway, and some of the many measures that they've taken out there to alleviate this problem, they still don't have a case. So I think they need to be certainly anybody that you come in contact with North Point, please talk to them and tell them how much we appreciate their being there, because as you very well know, if the virus were to ever become very active in a facility like that, it could be certainly catastrophic. They've done many things out there. They've got cleaning crews, their sanitation practices have totally been revamped. They've got, well, they've just had to change everything they do. Of course, their visitations and things of that nature has been temporarily halted. And one of the big things they do is just the fact there's so much standing in line at a place like this. Being able to get the social distancing, the 6 feet between them. They stand in line for food. They stand in line for pill call, canteen benefits. They all stand in line for that. So they pretty much had to change the same way they do things out there. And again, just a point to make that the fact that what a tremendous job Warden Adams and his staff has done. But I wanted to point that out because a lot of times we think of North Point, we don't, if something goes wrong out there, we certainly all know about it then, but what they're doing to keep that virus under wraps is something pretty well. Mayor, you got some comments? Mayor? We've lost Mayor Perros.
I think you may have lost him.
Okay. Well, let's move along. If he comes in, we'll get him with that. But Kathy, we're so glad to have you, and glad you're here. And please,
The mayor is
Is
with
that the
me
mayor?
now. Would you like the mayor?
Is he there?
Yes, he is here now with me. Would you like for him to speak for a moment?
Okay.
He crashed where he was, but he can use mine. So, Mayor Perros.
Let's see where we are.
All right, Mike, you there?
Yes, sir. You there?
Yeah.
There
Here
we go. The floor is
Go.
yours.
My internet rarely ever crashes or ceases to work, but of all times it did today. So here we are. Anyway, the one thing that I wanted to add is I know that with the weather turning nice and all of us are starting to get real antsy and real short, and we all want to get out and about and do and get back to a normal regular life, but that's just not in the cards right now. And I saw a cute analogy that I would like to share, and it basically said that, now that we flattened the curve, it's okay to get back to normal life. And that's kind of like saying, well, you know what, now that the parachute has slowed down our descent, it's okay to take it off. that's not really very smart. And so we just don't need a resurgence of this. Everybody's done a fantastic job of sheltering in place, if you will, and just trying to keep a lid on it. And our numbers prove it. I'd like to keep it that way. Again, I understand the complications. I understand the impatience. I get it. But we've got to do the best we can until we can get sometime further down that this whole coronavirus situation is better under control. That's my story. I'm sticking to it.
You want to introduce your guest?
Pardon me?
You at your desk.
Do you want to introduce your guest?
Oh, introduce my guest. Well, my guest is the one and only Kathy Miles. Kathy is a sociologist, psychologist. And she knows how people's brains work. And I know I asked her to be a part of this because, as I said, we're all getting real antsy and temperamental, and I thought maybe her words of wisdom would be beneficial. So let me pass this back to her.
Okay. Have you got me?
We do.
Okay. Actually, I'm a marriage and family therapist and a licensed alcohol and drug counselor. I have to be clearly, and I am the coordinator of Boyle County Agency for Substance Abuse Policy. And I do want to say, because those North Point folks are very involved with us in the Agency for Substance Abuse Policy, which we call ASAP. They are the greatest. Their staff are wonderful. They are reaching out to our community and have been for a long time, and they do a wonderful job. And thanks, Mike, for bringing that up, because we really appreciate working with them. And they are all about helping their folks be successful at reentry into the communities when they leave North Point. So just wanted to say thank you for that. I think that y'all asked me to be here to talk a little bit about mental health and substance use issues and what we're seeing in terms of stress in the community and what people can do about it. So let me just say a few things about that. I think the first thing we've got to say is that information is extremely important for people. And thank you for doing what you do with these 3:30 webinars on Mondays and Thursdays. People need information. I think that's why everyone is circled around their televisions, watching the governor every day at 5. And the right information is what's important. It's information. Some of the information that's out there is not good. It only produces more anxiety. So we want the accurate information. We want honesty. And we also, the second thing would be support. Social distancing does not mean that you can't have support, and it doesn't mean you shouldn't try to get support for yourself and for your family. I think people probably need it even more right now because we can't get it in the normal kinds of ways. So everyone needs to understand you don't have to be socially isolated, even though we're doing social distancing. And we just want to say, please reach out to people that you know may be alone, and people that you know just may be really struggling for a variety of reasons. The third thing besides information and support would be take care of your basic needs. So everybody needs to be trying to get enough sleep, and everybody needs to be trying to get some exercise if they're able to do that. Particularly get outside if you can, because it's really good for your brain when you're out in the sunshine. And also that you eat properly. We have people who may be going hungry a lot right now in this community. Please reach out to food please use the food pantry. Please call family services. Please, if you need to, you can call the health department, right, Brent?
Yes.
To ask where you can get that help. Consult your pastor or go to faith communities, but we don't want anyone to be hungry during this time. We know some of those assistance checks have not come in yet that people are going to get. And there are people out there trying to make sure that everyone eats. And your mental health can't be good if your physical health is not. So just it's important to say we all have to do those basic things. And then there are the added things that we've got some concerns about for some people, the added things that people who come into this crisis already with pre-existing conditions and problems, that they need some extra help for, some extra support. And that includes, Mike, I think they may have lost us.
Vicky, line
Can
one.
you still see me?
I don't know.
We can hear you.
Okay.
You can't. Let me see if Mike can make sure you can see me. Sorry.
Okay.
Okay.
There you go.
We got. Okay, we got it. So we are just still in the opioid crisis in this community and all around Kentucky and across the country. And so we know we have folks who are newly in recovery, and we have folks who still need treatment. And we have lots of families who have someone who has been in active addiction, who have some special needs. We want those folks to seek the support they need right now, because whenever you layer one crisis on another, people feel more stress. So people who need to be doing online support 12-step meetings like AA and NA meetings, people who need to be calling their sponsors and talking to their sponsors as they're in recovery, family members who need to talk to someone who can just let them know what they're doing to deal with stress. We also have people who come into the COVID-19 crisis with long-standing mental health issues, including anxiety, depression, PTSD, schizophrenia. Some of those are conditions they need to continue to take their medications. And sometimes it's easy when you're in a crisis to not refill your medications, to not do what you need to do to stay on those meds. So we want to be sure to remind people to do that. We have lots of providers of mental health and substance use services in this community in Central Kentucky who are doing it by telehealth. And that's important for some people to know, because some people don't realize they can see their therapist through telehealth. So we have, for instance, we have community mental health that serves this area, and the name of that is New Vista. People used to call New Vista Comp Care. Then for a while it was bluegrass.org, but now it's called New Vista. And the local number is 859-236-2726. They are definitely doing telehealth. They also have a 1-800 number that people can reach anytime, 24/7, and that is 800-928-8000. And so people can access making an appointment with a therapist in Danville through that Bluegrass number. Also want to make sure that we talk about that depression issue for a moment, because everybody's life matters. We say that about COVID-19 and how everyone deserves to get treatment for physical health. We also mean it in terms of suicide prevention. If there is a 1-800 national number that everyone should have, if they don't, please write this down. 1-800-273-TALK, or you can text TALK to 741-741. And some people just like to text better than to call that number. That is a national suicide prevention crisis line. And it is okay. In fact, it's really good to seek help. It's a strength, not a weakness, to seek help. And so we want to make sure that people know that, yes, this is a tough time. And some people come into this already having losses, or just coming out of the military, just adjusting to civilian life. All those kinds of things are added stressors. So we want people to get the help they need. It is available. Maybe you're going to do it a little differently than you did when we didn't have to social distance. So it's kind of let's get the right information, let's get support, and let's provide support, and let's take care of ourselves, our basic needs, and then let's be sure that when we have those other things going on in our lives, that we do extra to seek support and to give support to other people. And by the way, it's great for depression if you can, to help someone else. It feels really good to just make a phone call and ask someone else if they're okay. And that helps your own mood and helps your own mental health. So that's just a tiny bit about all that. And if any of y'all have questions or anything you want me to highlight, please feel free to ask me.
Thank you, Kathy. We've got some questions. I think I'm looking at them here. Brent, can you see those questions?
I can.
Okay, good.
I can. Okay.
Can you? Well, it looks like to me they're probably right now going to pertain to 3. We have 4, and looks like the first 3 are going to pertain to Brent, basically.
Yeah, I've
Okay.
got them.
You got them?
Yeah, I'll answer them.
Take it from there.
All right. Well, first of all, Mayor, great choice on having Kathy with us today. I've known her since the middle 90s, and we're fortunate in this community to have her. She's just awesome at what she does. She represents populations in our community that aren't often represented very well. And we're fortunate to have her to do that. And she brings a ton of knowledge to all of us when we're thinking about this. So Kathy, thanks for doing that and for helping us out here.
Thank you.
Couple things. I'll tell you what, I'm gonna jump straight into the questions because there's several of them on here, and I'll answer what I can and see where we go from there. All right. First one, after returning home from the grocery store, do I need to sanitize my groceries? And actually look at the second one because I believe the second one. Okay. The CDC has a little guidance on that. And really what it says is, to date, there's no 100% evidence that how this virus is going to live on surfaces, how long, that type of thing. That'll come with time, some of that. But I think it's prudent just for some basic things. If you get home from the grocery store and you have some boxes, that kind of stuff, it's okay if it works for you to wash the box down a little bit or sanitize that if you want. Certainly, I'm not saying do that to your actual food, meat, those kind of things. You have to be careful, obviously, doing any of that. And the cooking process usually kills most viruses and germs that we have on meat. But, if that helps you when you bring in your groceries to do that, that's great. You can do that. Along with that, somebody asked a question about, hey, while I'm out, even if I'm just for a walk or where I go, when I come in, do I need to sanitize my shoes? And we've heard a lot more about that in the last week or so. And here's what I think is just a good practice. When you get into your garage, or if you don't have a garage, as soon as you walk in your house, leave those shoes right there by the door. Have another pair that you can slip on and walk to your house. Now, it's probably, we're already seeing evidence that, this virus, as many viruses does, can spread different ways. And so if right now we're thinking that's a possibility, just make it a good habit. Take your shoes off, put on another pair of slippers, sandals, whatever you got, and do that for a while until we understand this better. You certainly, if that's, you don't have another pair of shoes to put on, certainly spray them with a disinfectant, wipe them off, anything like that before you wear them through the house, or just take them off and go bare feet if you can, or wear your socks to do that. And then, for both of those things, when you're coming in, as we're learning new things about this virus and how it works, both of those things with if you want to wash off the boxes or wipe down the boxes of your food and the shoes, those are 2 things you can do right now to help. Now, I'm not saying by any means that the stuff coming from the stores, the food or anything like that is all contaminated. I'm not saying that at all. Our food supply has been great about what they're doing. They're being very conscientious about how they're supplying food to us, and we're grateful for that. So I just want to be clear on that. But these are just suggestions to help us as we look for different ways to avoid the spread of this virus. Okay. How should I handle takeout food from restaurants? Definitely, we're encouraging people to do the takeout food. It supports our businesses. Sometimes it just gives you a chance to eat out after you've been eating at home all week and to enjoy some really good food from these restaurants. There's a lot of people working in these restaurants that really rely on that income just to make it, as a lot of people are experiencing that with the businesses they've been in that are shutting down and cutting back their workforce. But what we do from the health department, our environmentalists have been all over the county repeatedly, and we continue to do this repeatedly, making sure that the restaurants are following the environmental guidelines they need to on a regular basis, but also with the COVID-19 stuff that's come up. We're making sure that they're trying to do the best they can with that and making sure they're meeting those requirements. And like I say, we continually have 2 people out on the road every day doing that to ensure that. So definitely go eat, go call one of these restaurants and do the curbside drive-through, support them because they need help right now in this time period too as a business. Okay. This one was, should I go for a walk or running? Should I disinfect my shoes when finished? And same advice that I've said coming in from anywhere else. You can do that. And I get it. If you've just been out in your yard and you're just hacking around in your yard, it's a little different thing, but just make it a good habit for a while, just to change your shoes before you come in. All right. Oh, here's a good one. If you are a coronavirus carrier, will you always be a carrier and a danger to others? That's a great question. And it's one of the things that, particularly on the scientific level, they're trying to figure that out right now. What does that look like? The antibody tests that they're talking about right now, trying to develop, how is that going to be able to monitor if somebody has already had the virus, but how long can they go that they're no longer contagious, that they won't pick it up again, any of those things. So I think that one is a little bit in flux right now as we figure this out, what's going on. However, I do think it's encouraging that you hear sometimes with Dr. Fossey and some of these other top doctors that are saying, hey, if you've already had it and we can prove that you're exposed to it, that might be one of the keys to us as we go through this process in figuring out this virus, on figuring out people that are ready to go back in a workforce, particularly people who are working with a vulnerable population. So I think more to come is on that. It's just a work in progress, but hopefully soon they'll have a much better understanding of what that long-term piece is. Now, it might just take a while. It just might be how it is as we figure this one out. Flu has been around a long time, so we've got a lot of information on it, as well as other viruses, but this was a new one. So our knowledge changes daily at times. All right, a walker in Millennium Park notices restrooms have been closed and replaced by porta potties. Are they more sanitary safe than the restrooms? First, I wasn't aware that they had porta potties out there. Any bathroom is going to be no more safe than the cleaning that happens to it. It doesn't matter if it's a bathroom, a porta potty, whatever that is, it won't matter. So, hopefully those are being cleaned on a routine basis, and we can check into those, but I just was not aware of that one. All right, and then, okay, when the courthouse reopens to the public, will plexiglass protectors be installed to promote social distancing between public and employees? And I would think Mike or the judge could answer that one. I think a lot of businesses are looking at different models from now on of how to do that to somewhat separate us. And it seems like you go in a lot of these businesses now that are still open and you're seeing that. I think a lot of these things will continue to be used, which is probably a good thing, not only for right now, but for viruses in the future, for us just to be used to that. So
Brent, there has been some discussion about that. I don't think any concrete answer has been given to it yet, but I suspect when the judge gets back in the office, there'll be some more conversation about it. It's like everywhere you go that there is a place that is open and you have to check out. They've got the plexiglass up. It's a good idea.
Absolutely. And I do think a lot of these measures we're doing now will just become routine standard practice for us in all the businesses as we get back to whatever normal will be for all of us, however that's going to look. As of, and I'm getting ready to hit the button and hit my Facebook update every day, we have 14 cases, no new confirmed ones today. So we're always glad of that, but also try to help people understand and just remind you that, you know, when we get cases, sometimes it's not that the case isn't there. It's just that they haven't been tested. I think there's a fair number of people who were probably sick during this time period who just never went and got tested, who never went to the doctor. They just stayed home. It wasn't severe enough for them to do anything different. And so they recovered and went on. And I just think that's kind of how this works. So the cases we know about were tested. And, but also keep in mind, along with those 14 tests, there was probably 50 to, 70 or so different other people that were affected because we had to quarantine them. We had to have them report to us daily, those type of things. So those cases branch out quickly. You'll see and as Mike talked about the long-term care, I certainly back that up. And I've had a few instances where I've talked about this before, but they are fighting a battle daily to protect the most vulnerable people sometimes in our population, as well as the staff do that are taking care of them. And they fight hard every day to try not to have these cases in their building. And the reality is, if you look around Kentucky and the United States, there are plenty of these long-term care agencies that have COVID-19 in their buildings. And it can be really difficult when it is there. Keep those people in your thoughts and prayers. That's a tough battle. I mean, you heard me talk a lot about Ephraim and our providers and the tough battle they have, where our long-term care people are right there with them, including, as Mike said, our prison system we have here, which is a lot of people. That's 1,500 or so people by the time you include everybody every day. One of the things when Mike was talking about the testing, one of the things we've been fortunate about in this community is Ephraim, as well as some other private providers, started testing early on. We're probably well into a month worth, if not longer, that these agencies, actually it's been a lot longer than that, have already been testing. Whereas there's some other counties, they probably have little to no testing already. So, you know, for us, that's been good. Ephraim, I think, is already working with 6 different labs, as well as some of the private providers are working with a lot of different labs also. So for us, that's a good thing because it helps us have a truer number as opposed to some of these other counties who have had very little to no testing, and they struggle to know kind of what they look like in their community. Okay, Mike, have I missed any? Did I miss any?
I think you've got them all, Brent. I do.
Oh, okay. Hold on. Here's something. The city manager, David, said the porta potties are from a construction site, not placed there by the city. So they do have a big construction project going on out there with the school, and maybe there's a couple other things going on. So that clarifies that those are used for those people in the construction business.
Good. All right. Mayor, you have any other comments to make? I believe he might have.
I think we lost him.
Yeah, I think we did too. My only parting remarks is very simply, for goodness sakes, everyone keep all of our healthcare workers, our medical staffs, and our first responders, EMS, fire service, all of those people, continually keep them in your thoughts and prayers, because the job that they're having to do under very adverse circumstances is very difficult. So again, think about them all you can. Without anything else, I think we will check off here and possibly see folks again on Thursday afternoon. Thank you very much.
Thank you.